Good morning, I am Dr. Jaideep Basu. I am a practicing gynecologist staying in Salt Lake and practicing in around Kolkata. For the next 2 minutes, I will be touching very briefly on ovarian cysts. See, we know a woman has got a uterus, 2 fallopian tubes and 1 ovary on each side, that is 2 ovaries. Now, what is the job of the ovary? To ovulate, to produce the hormone estrogen and progesterone. If it is adolescent, just to have a normal period. When you get married, the egg formation is expected to take place from the ovaries and you conceive. But physiology is also accompanied by pathology. So what are the pathological conditions which we as doctors encounter in our practice? A young child, I should say, who had just attained puberty, 11 years, 12 years, 13 years, will have an ovary commensurating with his age and the size of the uterus commensurating with his age, with her age rather. But at times, unfortunately, it has been seen that big ovarian tumors can occur also. Normally, they present with pain abdomen or sometimes swelling of the abdomen, bloating of the abdomen, loss of appetite. On sonography, we see that a big tumor. Normally, it is unilateral. Tumors at this age are to be viewed very suspiciously. So, what are the investigations we do? We can go for a USG lower abdomen. We can't do a TVS naturally. You have to go to USG lower abdomen. You can go for CECT or you can go for an MRI pelvis. And along with that, we go for routine blood tests and we do 2 specific blood tests, blood for serum beta HCG and alpha fetoprotein, and naturally CA125 is there. We have to diagnose it and treat it. The treatment in majority of the cases is surgery. Then comes the adolescent group. Many patients come to a chamber and say, my daughter has got cysts. What it turns to be? Adolescent PCO. Small cysts which can take place normally, physiologically, nothing to worry about, but they require follow-up in adolescent PCO. Fourth is they are tumors in the reproductive age group, childbearing age. It can be a simple cyst, clear cyst. It can be up to 5 centimeters. It is said that on sonography you see a cyst up to 5 centimeters. Follow up the patient. Treatment, surgery is not required. You can give oral contraceptive pills. But if the cyst after 3 to 4 months you see it has grown to 7 to 8 centimeters, then you have to may think of surgery, may think of blood for CA25, broma, etc. blood test. In a woman who is postmenopausal, that is, she should be completely dry. There should be no hormones at all in her body like estrogen and progesterone. If she has a cyst, tumor, sonography, CT scan, MRI, CA125, broma, it is to be viewed very, very suspiciously. In a good number of cases, it turns out to be malignant. Now, how to prevent it? It cannot be prevented, but it can be diagnosed early. In my private practice, if a 12 or 13-year-old child comes along with the mother and the mother says, oh, she is having a bit of pain, she is having little periods, I insist on a sonography. They tend to resist. They think, such a small girl, what to do a sonography about? I said, no, you should do a sonography because along with the good things, you should also rule out the bad things. So sonography should be done. And unfortunately, in 1 or 2 out of 2 or 3% of the cases, actually I have a girl whom I have delivered myself. I have to operate on her ovary because she has a large tumor and I have to remove the complete ovary. So in reproductive age group or postmenopausal age group, if you see there is a big tumor, go for a whole abdomen USG, whole abdomen CECT, whole abdomen to see whether there is fluid in the abdomen, whether there is deposit in the liver, or the glands are involved, or the retroperitoneal glands are involved, to see whether it has been disseminated or not. Depending we do that, we can do a preoperative staging, and the treatment in majority of the cases is surgery, that is debulking of the tumor followed by chemotherapy. In post-mortem muscle movement, if we see that tumor, we definitely have to remove it, that there is no place for any conservative surgery, and even after you do that surgery, you have to follow up the patient by sonography at least every 6 months to 1 year. Married women having an ovarian tumor requiring surgery, we do fertility sparing surgery. We do the surgery, send the tissue immediately for frozen section. If we see it is non-malignant, we do conservative surgery. If it is malignant, we have to do a debulking. So, depending on the age of the patient, the symptom of the patient, and what the patient wants, what is the patient's aim, relief from the pain, or wants pregnancy, the treatment should be individualized and be completely target oriented. One of the leading symptoms of ovarian cancer is not pain or swelling. Earliest symptom of ovarian cancer is dyspepsia. Dyspepsia means having an acidity, bloating of abdomen, not digesting properly. So what the patients do, they take antacids, they take digestive medicines. No, if it does not go by antacid digestive medicine, please go for a sonography. And what I personally tell to my patients after 40 or 42 years of age, go annually for a whole abdomen USG. It is very cheap, but it can be life saving, and it can prevent a lot of harassment to you and your family members later on. Thank you very much. I hope I have been able to convey briefly few details to you to make you aware and make you more alert. Have a nice life.